I'm talking to Dr. Devina Halsall, who's a senior pharmacist at NHS Merseyside. So, Devina, why is pharmacy a useful route for provision of public health services?
Three reasons really. Pharmacy is highly accessible, they're great at reducing inequalities, and they also provide a range of healthcare services that improve the health and well-being of the local population. In terms of reducing inequalities, we tend to find that the people who use pharmacies most frequently tend to be the most vulnerable in our society. So that would include young people who are trying to access sexual health services, substance misusers who might want to access substance misuse services. We have a lot of the traveling population that use pharmacies, and also people who are taking care of loved ones at home who are either disabled or terminally ill tend to need to use pharmacies on a daily basis. The reasons for these include the fact that pharmacies are highly that they are approachable. The people who work in pharmacies are very approachable. You don't need an appointment to access most of these services, and there's a level of anonymity as well in terms of being able to go into a pharmacy and use those services. When you're looking at the accessibility, we have over 11,000 pharmacies across the country, and in each of those you've got a pharmacist who is responsible for the running of that set of premises, and they're university qualified and registered with the GPHC. Working with them is their team, and that team involves pharmacy technicians, dispensers, and medicines counter assistants, and they also have to be qualified in terms of the use of medicines. So that's a very highly skilled team that you have. When you look at public health services and trying to change behaviours and encourage people to change their lifestyles, you need to have those services available at a time when it best meets their needs. So take, for instance, smoking cessation services. If someone decides that they want to quit smoking, they need to be able to almost immediately be able to go into a healthcare provider and say, this is my quit date, and have the support and counselling around those issues. And then also have somebody available who's able to help them choose the best medicine for them to help them to quit. So the best nicotine replacement that's available, that's going to not cause them harm and allow them to be successful. Pharmacies provide a wide range of other services that try to improve the health and well-being of the local population. So these include sexual health services such as chlamydia screening and emergency hormonal contraception. It also includes substance misuse services such as supervised consumption of methadone and needle exchange services. Another example is that they provide easy access to palliative care medicines, and these are used to help patients, to support patients who choose to pass away at home or in a hospice. Not only do these services decrease pressures on the rest of the health economy, but they provide patients and their carers with a choice of where to get care so they can receive care in the manner that's most convenient to them. And this care that they receive is evidence-based care as well. So that's quite unique. That's quite unique to pharmacies as a healthcare provider. They're highly accessible, they have the potential to reduce health inequalities, and they also have the potential to improve the health and well-being of the local population.
Devina, what are the possible routes for commissioning public health services in the new NHS?
Right, well, we anticipate that public health services are going to be commissioned by health and wellbeing boards in the future, and those sit within the local authority. The question is that how will the health and wellbeing boards know which services are currently being commissioned? How will they know which services to commission? And how will they know that pharmacy is an option to commission from? So right now across the country, groups of pharmacists are getting together and forming local professional networks, and these LPNs are going to include pharmacists from primary care, secondary care, community pharmacy, academics and CPPE tutors, and we're hoping to also include their technicians and dispensers as well. And one of the main things that they're going to be doing is looking to see what pharmacy can offer and integrate what pharmacy can offer into existing care pathways. They'll have a number of functions, but that is just one of their functions. So take, for instance, a patient who is terminally ill. Their patient journey might start from home and then move into the hospital, back home, into a hospice, and then again back home. And throughout this journey, they're going to need medicines. The question is where are they going to get their medicines from? Are they going to get them from the community pharmacy setting, from the hospital setting, or can they access them through the hospice? So a good LPN, an effective LPN, will take account of this and ensure that this is commissioned appropriately. A second thing that's important is to have an understanding of two documents: the pharmacy needs assessment, the pharmaceutical needs assessment, the PNA, as well as the Joint Strategic Needs Assessment, the JSNA. The PNA outlines gaps in current pharmaceutical services provision at a local level, and the JSNA outlines health needs of that local population. Commissioners currently use these two documents to inform their decisions and to help them prioritize in terms of what should be commissioned and what should be decommissioned. These currently sit with the PCT, and they can be found on each PCT's website. These will eventually move across to the health and well-being boards. If anybody wants to design a service to meet local needs, then they should become familiar with these documents and use them in terms of designing their services, negotiating their commissioning, and then also when they deliver these services.
So how will community pharmacists make sure they're seen as the preferred provider for these services?
Right. Well, there are two things to think about with that. The first is at an organisational level, so the pharmacy organisations themselves and what they can do, as well as the individual pharmacists and the pharmacies. At an organisational level, you've got your LPCs, your LPNs, the local professional networks, as well as any pharmacy development groups. And what they should be doing, or what they could be doing right now, is trying to build relationships with these new commissioners. So with the new commissioners being the health and wellbeing boards, as well as emerging clinical commissioning groups. Before doing so, however, they need to start to do a SWOT analysis to understand what their unique selling points are. They also need to have an understanding of the gaps in delivery and how they can address those gaps. They also need to have an understanding of what measurable outcomes they can deliver on. So when they approach these new commissioners, again, you're thinking in terms of, these are your gaps, these are how we can help you address your gaps, and these are what we can deliver on. There used to be a time when pharmacies would say, we're pharmacists and we want to deliver these services. That won't work anymore. It's important to be really, really focused on on what you can deliver when approaching these new commissioners, because right now they've got a huge and challenging agenda. In terms of what pharmacists and pharmacies can do, they need to continue to build their credibility up as stewards of healthcare. So in terms of, and I'll give you a few examples of that, in terms of MURs, now is the time to provide fantastic MURs that are useful to patients. Now is the time to, if for instance you need to order specials, get in touch with the GP practice and let them know how much might be coming out of their budget, and offer them a solution if there's an alternative available. So you're not only identifying problems, you're also offering solutions as well. Another example is if you're ordering on behalf of patients, ordering repeat prescriptions on behalf of patients, make sure that you only order what the patient actually needs, not just everything off of their back slip. So, and if you see issues around non-compliance, or if you see potential waste issues, get in touch with the GP practice as well and let them know this. You're always supposed to be offering solutions now rather than simply identifying problems, and that will continue to build your credibility in the eyes of these new commissioners. Pharmacies are great at making sure patients get the best out of their medicines. It's just now that we need to actually be seen and be more visible in doing that.